I have to introduce Wendy McGuinness from the McGuiness Institute. Wendy, with her surname of being McGuinness, she's clearly the founder and chief executive of the McGuiness Institute. She's worked both in the public and private sector, specialising in public sector reporting, risk management and future studies. In 2004, she established the Institute as a way of contributing to New Zealand's long-term future. Since then, she has, with her team, published a range of reports under the title Project 2058. She's written the book Nation Dates, Significant Events That Have Shaped the Nation of New Zealand, and attended 4 World Futures conferences. McGuinness Group has studied the pandemic since 2006, and just this year, of course, she undertook the survey in collaboration with NZNO called Survey Insights and Analysis of the 2020 NZNO PPE survey. So here she is to discuss the survey findings, latest research and reasons why we need royal inquiry into New Zealand's response to COVID-19. So I'll pass on to you now, Wendy, with an analysis of the 2020 PPE survey.
Thank you very much. Kia ora, everybody. How are you? That's a really big question today. Your industry, if you like, or your community has been so significantly important for New Zealand and our economy going forward. And so I just personally wanted to thank you for that, your hard work. What I wanted to do today was obviously talk a little bit about the survey results. There is actually quite a detailed booklet that I'm going to go through. I'm not sure if you can see me on screen at all, or if you just see my PowerPoint, but you can see the cover, and it covers quite a lot of detail. What I would like to do is just to go through the survey briefly, and then talk about some of the sort of concepts and things I'm thinking about right now, and wanted to share those, and then open it up for Q&A. So here we go. Firstly, if you know anything about surveys, it's all about the context. And you can see this big mountain in front of you. I was highly aware that once we sort of go through something, we often forget it very quickly. So we had this idea of developing a survey quite quickly, and we were really fortunate to collaborate with New Zealand Nursing Organisation. And we were really delighted with the level of response, and so I just wanted to thank people for that. The critical thing was to understand where we were. So we'd gone through something and we were coming down the other side. We were all relatively elated. As you can see on the 23rd of April on that far little bubble, the WHO situation report shows 0 new confirmed cases for New Zealand for the first time. So you can kind of imagine we were getting people that were feeling, oh my gosh, we've got through it, everything's going to be terrific. And so we used this little opportunity to gather some thoughts and ideas from your community. The community, the people that responded, this just gives you a really quick overview of the number of registered nurses, caregivers, and so forth. And we actually talked to people from across, or had people respond from sort of every DHB. Obviously, there's some that were engaged a lot more than others, and that's all clear in the survey results. I won't go into that in any more detail. Basically, the graphs all look relatively like this. We asked people to score where they felt over different topics or different issues. We had sort of 9 very closed questions, and then we had a very open question at the end, and I'm going to come back to that in a moment. So the closed questions were basically just give us a quick scale. We knew you guys would be super busy, so we just wanted to keep it, really snappy and be able to graph the results quite quickly. So this kind of gives you just a little bit of an example. On a scale of 1 to 5, where 1 means not supported at all and 5 means very supported, how support do you feel in the move from alert level 4 to alert level 3? So the red is obviously indicates very unsupported, and unsupported, and obviously the blue is on the right. And I'll just give you another question as an example. This one's, how confident are you that New Zealand has the necessary PPE? So once again, quite a lot of red on the left. Obviously what you'd be wanting to see is a whole lot of blue and nothing red, but that's obviously not the case. So that was how we sort of, that was the audience and the type of questions that we put to you to try and understand. And we had sort of some quite detailed things like this to say, who of the total responses, and that's looking at the navy along the bottom there, who within the DHBs we have really noticed shortages in areas. So this, for example, has the masks column, the first row, first column there, the P2 and the N95. And that indicates that Auckland DHB, there were 50 respondents that had indicated that they'd seen shortages in these areas. So every bit of information, we were really pleased with the survey in terms of it sort of really gave an insight and a history at a particularly important point in New Zealand's time in dealing with a new virus. What I wanted to talk about is really broadly those ideas or things that we learnt, if you like, in terms of how you informed us of your community and what was actually happening. So, like I said, the survey's easy to find both on NZNO's and our website. Some really interesting things, and I've done surveys for years, and as a community, I thought this was a really important takeaway, and it was that there was enormous differences in how people were affected. And we did some real digging to try and understand what was the triggers and what was happening with that. And I think COVID can only be seen, and I've been trying, I love analogies. This isn't a great analogy, but it's the best I've got. You know how when you use a sieve and you've got that metal sort of sieve like this, if you like. Basically, the layers of that, if you put a whole lot of those type of sort of metal arrangements with, sieves, if you like, on top of each other, some of the water will, if it has the ability to go through all the different layers at once, will create a lot of force and have a big impact, whereas others will not. And the example of that, if you said, where you were mattered a great deal, just in terms of where you were in the country, if you were in Queenstown versus if you were in, I'm just saying, Oamaru or something else, these sort of locational aspects were really important. The second thing, another layer, was what you were doing, whether you were a nurse in a hospital, and if you were in a hospital, where you were working in that hospital, versus if you were a school nurse or you were in a community care organisation. So massive differences in that way. Also differences in terms of age and, if you had potential health risks yourself, your vulnerabilities, that also had an impact and came through in the comments. In the survey results, we actually included a lot of the survey comments because they were so valuable in terms of providing such a great insight. So if you can imagine, some of you were in situations where the impact, if you like, the water flowing through those different layers actually never hit you because there was always something else in the way and you were sort of protected. But for some of your community, you were very impacted. And, some of you, when I talk to you, will know that you were. And there's a whole lot of reasons for that. So if we dug a bit deeper, anyone that had, as part of their normal business, day-to-day work, dealt with PPE, they found that easy. Their systems, the logistics, everything was working normally. There wasn't any sort of restrictions. They knew how to do it. that wasn't difficult. So they didn't have supply issues, they didn't have understanding how to wear it, et cetera, et cetera. But those that had not been or were not in those situations or had management that had no experience of even where to buy PPE or what to do, how to put it on, how to supply it, really struggled. And so in the response, for example, you get people, in the community saying things like, I don't understand what all the problem is. This isn't a really big issue. And then you actually read some of the other comments and you go, wow, that's not easy at all what someone's having to deal with, trying to get PPE and it's locked away, getting PPE that doesn't fit, et cetera, et cetera. And so in some ways, I do hope that the people that found it quite easy might pop into the survey, particularly the back of it, and actually have a look at some of those comments and have an understanding of what it's like. Now, what my view is what's happened with this community broadly is what's happening to New Zealand. So some people are very impacted, some people are not. And some people are challenged because, they're more isolated, have been dealing with some really difficult situations for a long time, have felt very isolated, etc. And I think that's something that both as a community of wonderful people that can actually really help and have enormous impact on people's well-being, versus even more broadly wider New Zealand community. So when you ask people how they are or what their experience is, you actually need to sit and listen because they're so different. And to try and bring New Zealand together is going to be quite a big challenge because of that. And it will, I believe, amplify poverty and inequality. And we will have to work really hard to try and create mechanisms to manage that. Right. So I'm just going to go on to just highlight, this is the survey recommendations. So we came up with 13 of them. They're all pretty obvious, I think. I'm just going to pick up 3 and re-emphasise them now just for the end of the talk, and then we can go to Q&A. So that's, I think they're pretty self-explanatory. What I want to talk about is that obviously we're in a situation, and this is an image from yesterday's paper, Radio New Zealand actually, and it's just really showing that we don't know, stuff's still going on, isn't it? And, it's not looking great. I mean, it's not unlike Melbourne in its early days. And thank you to all those Aucklanders that are applying 2.5. But, it's going to be tricky. So I just think it's a really useful diagram to actually understand this. We are dealing with, which an incredibly tricky and difficult and sticky virus. So what does that mean? If I said my top 3, I would say the first thing is we actually, and I'm not hearing a lot of people talk about this, but I would be wanting to review and study every COVID-19 positive case. I think that we, at best, we're 9 months into this beast. And I'm not hearing a lot of studies. Like we're starting to hear a lot of people that are not recovering properly, and we have these bodies for a long time. How they get impacted will have impacts over the long term, whether it's pregnancy or other issues that you might have that might, with COVID, impacts that you can't see at the moment may end up having impacts. So I really would recommend, and this could be just a simple 6-monthly review with every COVID positive patient, collect the results and actually do some analysis and actually try and understand if there are any ongoing issues. This has the benefit of both optimising the care for the patients, picking things up early, in other words, and being an ear and supporting them. But secondly, it's about designing the healthcare system for the long term. If we can see, for example, these respiratory issues, particular organs that might be more challenged, we can start actually building the design and the healthcare system for them going forward. So basically I put this, we need to get ahead of this, and we need the information to do that. So something I'd like you guys to think about pushing, if you wouldn't mind, would be great. Second thing is around requiring regular reporting. Now, in front of you is the Ministry of Health. Won't be surprised I've raised this issue. So one of the first things I did was to understand what we had, which is when you're a disaster, that's obviously what have we got in the cupboard. And so I actually had a look at, it's the National Reserve Supply of includes PPE and other gear. And the idea with this is that it gives the country a snapshot of what we've got, and we actually try and design it for, the emerging pandemics that may come about. And it was a great initiative, probably came around SARS, and was definitely in the, I think, 2011 usage plan, and is in the 2017 influenza pandemic plan. And so the first thing I looked at, 28th January 2020, yeah, okay, stock looks good. And then I kept on looking at it, and it never changed. And it only just changed last month on the 26th of August. Now, if you're wanting to give a country confidence and a community that needs this equipment, this is actually critical information that I believe in a pandemic should not just be produced monthly by the Ministry of Health as a requirement, but it actually should be audited. It is that important, because it gives the ability for the community and your community, but the country, to actually understand and have comfort. And you'll remember all those questions in front of Jacinda and the Ministry of Health, Bloomfield, and, they weren't really very clear. And in my view, I think that it was very messy and not well managed, whereas this is a really simple thing that can be put in place and can provide a lot of comfort. So you can see in here the PPE stored numbers. So it's got, we store two different types of masks, P2 and general purpose, and they're saying they've got 11 million P2s and 7 million general purpose. Well, that may seem a lot, but actually for 4.5 million people, that's probably not a lot, since they're very disposable. And also, you don't know very much about their size. I mean, it's good that the data's there. The numbers don't scare me, but actually they probably need to be higher, and you need more data to know that you've got the product that you need. So that's dealing with recommendation 2. And of course, the third thing, which the lovely gentleman that introduced me, was that we do need a royal inquiry. I was really pleased Helen Clark actually emphasised this. I quite like to comment a full reflection. I'm going for a royal commission because I think that would be the best way to go. And I really like to quote, we have to learn the lessons. In many ways, we dodged a bullet. We were not ready for this. Now, most of you will know, but I am going to just repeat it if I've got another couple of minutes. I know we started slightly late, so I'm hoping I've got that. Yes, okay. So coronavirus was identified in animals pre-1960, but the first human coronavirus was early 1960s. And then it was really only in the 2000s that it started, different varieties were emerging and it became sort of more of an issue. So that gives you sort of 60 years of an emerging new kid on the block, if you like. And there was some science into that. But, the pros and cons of that is, of course, we only had a 2017 influenza plan. We didn't have a coronavirus plan. And the second thing to understand is that, so we weren't very responsive or very watchful. And I've got an OIA out there to see if I can get an update of the new plan that's been sort of talked about. There's been talk about that it was rewritten in a week by Minister of Health. I'm not quite sure where that's landed. That's where I'm really interested. But obviously we know when we go back to 60 years of a coronavirus, we may have something completely new that basically takes the world by storm, putting it that way. So we actually need to be very reflective here. And my view is that this was a moderate pandemic. The mortality wasn't in it, it hasn't been a significant issue, which obviously it is. Still people passing away, but just understanding the difference between a moderate and a severe pandemic is really important. And if I am correct in my thinking that it's moderate, then we need to actually be prepared for the severe. And I thought I'd open it up for questions now, so thank you very much.
Thank you very much, Wendy. So first off, Aseta asking what the response rate from Pacific nurses on the research.
From memory, it wasn't as significant as I would have thought. And that may have been because the Pacific community actually hadn't been very challenged at that time with the pandemic. But yeah, no, wasn't very noticeable at all.
From Henrietta, was there an analysis of the difference between the feeling of support, availability of PPE, and the actual provision of support and PPE?
Yes, there was. I think there's probably two aspects to that. So it was very different where you were. So in terms of your how confident you felt was very determined by the type of work that you were doing, as I said earlier. In terms of your second part of your question, which is to find out what sort of stock was available, that has been an ongoing headache for me. Another set of OAAs has gone to HDHB, where we've actually been trying to understand the stock levels. And I can tell you, and I'm sure they would be no surprise to you, that has been really difficult for some DHBs to answer. In fact, some of them refused. And for me, that's a really big issue. And I'm pleased you asked the question because, look, it's logistics. And I don't think government is naturally skilled at logistics. Businesses are. And I think the health industry in a totality, we're actually, really caught off guard and didn't actually have the skills or the systems or the thinking in place about how they would supply. And you would have read the Office of the Auditor General's report. It was really terrible out there for a lot of people. And so not a good match and difficult to try and get the detail.
So the follow-up to that from Henrietta was, is this a PPE issue or a communication of risk issue?
Very good questions. Okay. I think that it's both of those. I would like to feel confident that the logistic issues have been resolved. I've definitely been told that they have, but they were so poor that I think it would deserve a further review for me to feel confident with that. The risk communication is a really interesting issue because most of you will have come across that communication analog protocol where you talk about, are we talking parent-adult, are we talking adult-adult, are we talking, parent-child, adult-adult, or are we talking parent-child? All the different ways that you can communicate. And there was a lot of parent-child communication coming from Ministry of Health and from the Prime Minister. And I'm not sure if that worked as, I think that's been a little bit problematic. it just depends on the way that you like to be treated and you like to treat other people. There's always going to be a case when you have to go parent-child. And I really thought the experts did a fantastic job. So you can see I'm trying to be very careful in how I answer your question. But actually, I think it's really important that an adult conversation happens. I think one of the things that exposing New Zealanders to the idea that actually we didn't have the PPE would have been a very good way of making people understand why we had to go into lockdown and why we had to stay in lockdown for so long. So, making that information available would have enabled people to understand the issues. Now, some of the feedback in the survey indicated that people had been told, we haven't got much PPE, so we've got to save it and we can't waste it. Now, that was putting people at risk, and that's the problem with miscommunication or communication not being relied upon or trusted. So we're lucky. We have a strong level of trust in New Zealand and the New Zealand government per se and the Ministry of Health. But actually, it wouldn't have required very much to undermine that, because I don't believe we were actually told the full extent of the issues that were challenging Ministry of Health. I think sometimes a problem shared is a far more productive way forward.
So what do you think a royal inquiry would offer that the Auditor General's audit missed?
Okay. The OAG was, I was really delighted they did the report, and their findings really aligned with the conversations that we had in the surveys, etc., etc. But that was really only one small component. That wasn't looking at the quality of the PPE that was in place. It was looking at the logistics of PPE, basically, the supply side. It didn't look at the demand side, and then the Royal Inquiry needs to be a lot bigger than that. It needs to also look at things like the testing, the type of communication, my view is that we were probably a week too late before we went into lockdown. We should have gone a week earlier. Definitely the information was there. You'll remember at the time, and there was groups of us that were fighting this madly, you remember the Prime Minister was still keeping the Pacific Community event open, and she was also going to fly down to Christchurch and do the Christchurch Mosque commemoration. Now, the information was there. It was really our spreadsheets. I really only realised 2 weeks before the lockdown that we had to lock down, but I knew we didn't have a choice. And the very early conversations we had in 2006 and 2011, when we both revisited this work, we always hoped that New Zealand would get a long window between what was happening in the rest of the world and what was happening in New Zealand. There was a risk that mightn't have happened, but a full lockdown of the country was always a strong possibility. And we didn't have a health system that could actually support that. So we were, it's a 2017 report that I read that the US put out, and they were talking about the number of ventilators and per population, and they were saying that, at least we're not as bad as Australia and New Zealand. So we run a very skinny ship here in terms of our health system, and we were, seriously in trouble. And so my view is that the lockdown should have been earlier. Easy to say, but I was telling people that 2 weeks beforehand. And, that had an impact on people's lives, and which is terrible, and which, I know it's a terrible responsibility for government, but, that's the reality. Yeah. And it also had an impact on, obviously, the nursing community. Such a high percentage of you did actually get COVID from doing your normal business of work. And I actually think that also requires some attention when we ask firefighters to go in and pull out a fire, save people or whatever. How we look after people after these events is also extremely important for the country. So a royal inquiry is everything. And one of the things that really worries me is the lack of information that is being collected for royal inquiry, because things move so fast. That's one of the reasons why I was so delighted to get the survey done, is because it at least gets a mark in the sand. At this point of time, people thought this, and this is what was happening to them. Because we do get in sort of the delight that we've got through something, and quite frankly, most of us want to forget about COVID. And that's actually sort of an issue for us as well going forward. But yeah, so really good question. So a royal inquiry is a completely independent inquiry into an area or topic of research. And in this case, it would be New Zealand's response to COVID.
So that kind of leads into the other, you've sort of answered it with Suzanne here, with 1918 pandemic had an all-of-government inquiry, and that's basically what you're saying, the entire response across all parts of the...
And so that should actually pick up the communication, the logistics, the timing. The situation around the masks, do you remember, I mean, this is how easy it is to forget. Remember, we were told that we didn't need masks?
Yeah.
and how that's all changed. And one of the things is because anything novel requires a high level of study to understand it. And with the coronavirus, I mean, particularly at that time, we're looking at March, we didn't understand how it spread. And so therefore, a precautionary approach wasn't taken, and mask wasn't being pushed, that button wasn't being pushed. And we actually had Lanico, which was a New Zealand manufacturing facility in Auckland, able to make masks that hardly anyone knew about. And so we ended up buying a whole lot of stock from overseas, not having assurance over the quality of that stock when we actually had the manufacturing facility in Auckland. So we actually weren't very responsive in terms of actually looking towards ourselves, what we had able and available to do to fill the gap to help improve New Zealand's outcomes.
So Julie and Suzanne both asking pretty much similar question here about the test fitting of N95 masks and the sizing. Is that part of your formed part of your OIA request?
Yes. And long gloves and a few other things like that. So it was. I really struggled with the very ad hoc way that it was approached. I mean, for me, it should have always been a uniform. And what uniform do we need for what situation? So, and going back to the firemen, how do we dress a fireman for going into a fire? And actually understanding that all the pieces of the equipment need to be put together. So, I sort of imagined that we should have been able to get to a situation where we actually created packs for different sizes, just like we do for everything else. So you might have small, medium, large, or some sort of mechanism like that. Now, whether that would have been possible because face sizes may have been different from body sizes, I'm not sure. But definitely the size issue, the quality of the fit was a really big issue, and actually, as you will know, caused many people to actually get COVID.
Yeah, the first mask I put on, the elastic broke. So another one here is, in terms of the timing of the inquiry, when do you think that should happen? Should it start now, or do we wait until all of this is over?
Another really good question. I think it should have started a month ago, maybe 6 weeks ago. If you're involved in heavy research, you actually need to collect the data. And one of the issues is, for example, you cannot go on the Ministry of Health website and get old copies of what was the guidance, what was the COVID-19 guidance for PPE in March, what was it in April. that sort of archival information you need to collect now. And I've been starting to try and as much as I can with our small amount of resources. But there's been an argument, we should wait for COVID to go. I'm afraid COVID isn't going to leave us for maybe. I mean, I always think business is the best indicator when some of the research is saying in central London they don't expect people back to at least July. Facebook's saying July 2021. So, there's a consistent view coming across that this isn't going to go away. And if we start a royal inquiry now, ideally like a month or so ago, they'd collect the information. They may be able to get an interim report out that it would actually help us right now with COVID. And we just haven't had this independent assessment. We haven't had an ability to have this collection of this really important data. Because, like I said, I think we've been very lucky, which sounds terrible, but we have. This could have been so much more, terrible, and yet we're all looking, to the honeypot and thinking it's all behind us, and we want to put it behind us because the experience has been so terrible. But life tells us, and you mentioned Nation Dates, which we're just doing the 4th edition, which will include a COVID-19 timeline, is actually understanding that, this timeline, there will be other timelines for other pandemics in the future, and the better we can start collecting that information and sorting it, which will take a very long time. And particularly, as I said, it's complex because it's impacted some people hardly at all. In fact, I had a sort of a wee joke. It was a little bit like, I never worked so hard. And all these people I was emailing were doing all these terrible late nights, and we were Zooming and sharing Excels, and the nurses were nursing and medical friends, and they were all up to the pump, and yet the reality was that wasn't the case for a lot of New Zealand. So, I had friends that were having wonderful times going for walks and losing weight, and life was a breeze, and what were they going to cook for dinner? And it just felt so unreal. And probably last to finish on that, I was talking to an American whose family are in New York, and I said, well, what's that like? And he said exactly the same thing. I've got medical friends that are completely wrecked and exhausted, and I'm sure that most of you will have contacts internationally that will understand what a New York hospital has been like for the last 3 months. And then I'm talking to other ones that just left New York, went to their country estates, and having a lovely time. And where do you move a country when you have that much difference? How do you go forward? How do you go forward in the nursing community to make sure that everyone understands that everyone's had a really different experience here, and yet we've got to get together to redesign the new system for the next one?
We'll have to get you back because I'm still getting lots of questions, and I'm being given the cut signal. So thank you very much, and it was great to work with you for that couple of emails that I sent. While we were proofreading the report. There's some more questions, one there that I can quickly deal with about whether the Infection Control Nurses College was involved. Yes, they were involved via the PNAs. So to everybody who wanted to know that one. And so thank you very much, Wendy. That was really great.
Can I just say one last word? Can I get that in?
Yeah.
Really quickly. One of the things that really amazed me as a survey result is when you were asked about questions about the system, I felt you were very protective. You wanted to be really positive because it was your hospital, you were very, you wanted to put on a good face. When I asked you that open question at the end about how you would improve systems or something, all the stuff came out because you wanted to improve the system for the patient, for the next patient that walks through, for the nurses in the future. And I would say go for your second feel, because that was so strong, and that's the thing that's going to propel you forward. The stoic I'll do the right thing because I'm a nurse and, it's a bit like a fireman, there's a fire, I'll put on my gear and go in no matter what. I actually don't think that's going to deliver better outcomes for your patients or the future outcomes. So do you sort of know what I mean? Does that explain it? Yeah. So, when you talk about your patients, boy, you are really, so keep that.
Thank you very much.
Thank you. Cheers.